The struggles we have in Denton County, and I think we really do look similar to other communities across Texas. The struggles we have is that folks seeking behavioral health run into two challenges. Number one, they'll find a long waiting list before they can be served. And then they find this fragmentation between service providers.
The Denton County Behavioral Health Leadership Team really convened as a policy-making team, someone who could facilitate system-wide change in our behavioral health system in Denton County.
What we didn't have before the leadership team was a vision where all of these resources can be pulled together.
The Denton County Behavioral Health Leadership Team is an appointed team made up of 31 members from different sectors of the community, from municipalities to healthcare, nonprofit, housing, local community groups, government, county commissioners court, and then 3 additional appointees that are actually serve as ex officio members.
As a county commissioner and as a keeper of the purse strings for the citizens, I'm always looking at economic development. When businesses get ready to move to Denton County, they want to make sure that they have healthy communities.
The Denton County Behavioral Health Leadership Team would not have been here if it weren't for Joe and Janet Moulton.
We are the lowest per capita funded county and the lowest funded state in the United States. So we had the honor of being dead last in the nation, and so I offered to make a contribution to the United Way to fund this committee.
We wanted to be in lockstep with where Texas as a state was going, and we wanted to be able to leverage expertise in this very complicated behavioral health domain. We began to realize there was an organization 1 county away, the Meadows Mental Health Policy Institute, doing some outstanding work at a national level, a state level, and helping local communities like ours.
The long-range goals of what we're trying to accomplish is to have a comprehensive mental health behavioral system set up.
We feel that we've made some really great strides and had some really early accomplishments, one of those being the establishment of our work groups.
The next step for the leadership team, I believe, would to begin implementing some of the suggestions from the 6 individual work groups.
We do have 6 work groups that are dedicated to child and family systems, consumer, mental health treatment court, housing, veterans, and jail diversion.
We've recognized for a long time that in law enforcement, that kind of environment in a jail or in a county jail or a state prison is not conducive to one healing from a behavioral health issue or a mental health issue. That's probably the last place to be.
Some of the things that we've been able to accomplish so far is looking at our jail. That's been a huge, that's the #1 provider of mental health resource or services in Denton County.
When somebody's acting out as a result of their illness, they don't usually pick up a phone and talk to a doctor. They call the police.
The Denton County Mental Health Court is designed to catch people that have a diagnosed mental illness that are starting to get into legal trouble.
My hope for the behavioral leadership team is that we'll develop a system that will allow people to get help when they need help before they come into contact with law enforcement.
This will allow them to gather resources, learn about their mental illness, come to grips with what they have to deal with, and put them on a path so that this is their one and only run-in with the criminal justice system.
The Child and Family Systems Work Group is dedicated specifically to really looking at the child and the family system. Within that, there's also the ability to also address maybe caregivers or those that are also working with maybe the seniors population, moms, dads. There's a Veterans Work Group, and that consists of community members, people from our university, veterans themselves, who have come together really to talk about what are some of the needs of our veterans in our community, many of whom are returning or getting out of the military with PTSD. The Consumer Work Group, which is a unique work group of the Denton County Behavioral Health Leadership Team, really is for us as a team to have a better understanding of what people are actually facing whenever they are entering into this system.
So in the end, I'm looking at a whole system where we will have citizens who have needs will have a place to come and get those needs addressed, and we'll just make a better place for Denton County.
This is kind of the nucleus or the beginning or the genesis of a program that every community in the state and in the United States needs.
Looking forward to down the road when I can say, look at Denton County if you want to see example of taking care of the people that need health care.